levels. The specific program that we'll be talking about is a program we've actually been doing for at least 5 years with the Maternal and Child Health Bureau, and we have worked in this program with every state early hearing detection and improvement program in the country. The purpose of the program specifically is to help improve the rates of follow-up for children who are screened at birth. Turns out at this point in the United States, pretty much every child who's born in the United States gets screened for hearing loss. But the challenge is that of those children who fail their initial newborn hearing screen, we actually don't know what happens to about half of those kids. So it's great that they're screened. It's great that we pick up children much earlier than we did before, but there are a significant number of children who are lost to follow-up. And the purpose of this project has been to help state health departments working together with their healthcare systems and working together with families reduce that loss to follow-up, improve the rates of follow-up, and make sure that all the children who need appropriate services and get hooked up into early intervention services get the services they need. We've learned that we need to have parents in our programs and projects at every level. And what do I mean by that? I mean, when we decide on addressing a particular topic, we identify a leader, a parent leader who can serve as a chair, as the chair of our initiative, who works together with whatever content experts we might have. So in this particular project, Janet DeGeorge is a fantastic parent who's also the mother of a child with hearing loss who was identified when she was 2 and leads a national organization called Hands and Voices, which is an organization of parents of children with hearing loss, serves as a faculty chair, and she's equal to any of the experts or quality improvement experts we have. Help defines what the changes are that we want to do, helps define what the measures are that we're going to use. Both at the faculty level and then on all of the state teams, all of those teams have parents involved in them, and they've helped in innumerable ways. One thing parents did early on was recognize the importance of what we call the patient's journey, or a map. So they created a visual tool that is provided to parents at the time the child is screened to tell them what are the different steps that need to take place afterwards, because it's a fairly complicated process, and it was extraordinarily helpful to have parents directly involved to say, this is what parents need to know. These are ways of conveying it. These are languages. This is language that families can use and understand. And it's become extremely important. In fact, it was so interesting because it was designed for parents, but it turned out to be so useful that clinicians loved having that same map or guidepost to help them figure out the complicated system. Another thing that parents were very helpful for was just helping inform the nurses in hospitals about how to best reach parents. So, for example, they would only be capturing one telephone number typically when the mother was in the hospital. They came up with some simple solutions like, why don't you get 2 phone numbers? And just that simple kind of change that parents suggested made a dramatic improvement in rates of follow-up and actually cut down costs for the public health department in California quite substantially. So those are the kinds of changes that parents have made consistently in this program. The question was, what happens in the hospital? Because newborn hearing screening is done by nurses typically, or by other staff in the normal newborn nursery. So it's not, the results aren't sent to some public health lab somewhere else for the follow-up there. The testing is done in the hospital. The nurses have to convey the information that's necessary, and that gets transmitted out. We've seen significant improvements, reductions in loss to follow-up, or improvements in rates of follow-up. So we have a better sense that children in specific states are getting followed up more frequently, that they're going. What happens at the newborn testing is a screening test. There's more definitive testing, so we know we're getting more children into the definitive test, and then from the definitive test we're getting higher rates of children who are being hooked up into appropriate services.